supporting countries.
In 2012, Kenneth Kabagambe was young, ambitious, and full of dreams until he was suddenly diagnosed with a life-threatening illness.
Hepatitis B by that time was a scaring disease with very limited information in the public, even at health level. So, but more importantly, I had just lost a friend to hepatitis B. So that is what triggered me to test. And of course, having learned that your friend or comrade has just died because of a disease like hepatitis B, of course you have to get scared.
What's worse, the diagnosis came as he was preparing to study abroad. The physical pain was tough, but the mental pain was torture. He was put on medication for HIV, which can also be used to treat hepatitis B. And in his community, that was a tough burden to carry. However, he decided to learn more about this disease and treatment. And what he found out changed his perception and altered his life's mission.
Taking medication that treats HIV and then you don't have it. So it was a tough situation. But eventually, with time, I had to manage it because I had to read extensively about it. And I am here as a living testimony.
Today, Kenneth has turned his pain into purpose, educating thousands across Uganda and beyond. But across Africa, millions still carry the virus unknowingly until it's too late. Globally, 1.3 million people die each year from hepatitis B and C, including over 300,000 in Africa. These are all deaths according to the Global Hepatitis Report 2024 that could be prevented with timely action.
Africans are dying from preventable diseases. I lost my mother to liver cancer attributable to hepatitis. I got infected with hepatitis B in a hospital setting that I could have been vaccinated. Babies are still getting infected from a disease that is preventable. That is unacceptable.
Health experts say the time to act is now, before more lives are lost. Every 30 seconds, someone dies from a hepatitis-related illness globally. Yet early detection and treatment could save millions. In Uganda, hepatitis remains a silent killer. But now the government is stepping up efforts to stamp out the disease. Ugandan health authorities say they are integrating hepatitis screening and treatment into routine care to reach more people, especially in underserved areas.
Integration is the way to go, especially in this era of unprecedented funding challenges, where we're already seeing a reduction in funding from development partners, but also as we progressively focus on individuals as drivers of the health agenda. We need to work together to bring the manufacturing of health products, innovations, and research closer to where the disease burden is.
Uganda is also adding a hepatitis B birth dose for every newborn, a crucial step to prevent mother-to-child transmission and lower future cancer cases. The path to elimination is long, but with survivors leading the way and a national push for early protection, doctors say the goal of a hepatitis-free generation is within reach. Mike Kobaleke, CGTN, Kampala.